Well, we're here with Dr. Leigh, a dentist from South Hadley, Massachusetts. Did I get that straight, Dr. Leigh?
Yeah, yes, you did. Yeah.
Beautiful. Well, Dr. Leigh, you're a dentist, and tell us something about your practice. You see, as patients, as laymen, on one hand, we believe a dentist is a dentist is a dentist is a dentist, because after all, you guys have all the diplomas, your thing. It's a rather structured profession. At the same token, however, we want personality, and we do believe that some dentists are different. After all, dentists, from all I know, is very clinically and very mechanically, machinery, kind of like engineering. It's like very exact science. At the same token, it has a tremendous amount of art within it, So we're looking for the right dentists, not probably quite knowing what the heck the right dentist is. So tell us a little bit about your practice. Are you like a family practitioner who sees children and also does dentures for elder people, who does cosmetic work and puts like Hollywood smiles on it, but at the same time maybe does just a normal everyday filling and that's it? Also, tell us about it. Are you doing orthodontic work, things? And if you don't mind, Dr. Leigh, what made you becoming a dentist? Shed some light on that too, will you?
What made me become a dentist really has to do with, establishing the relationships and basically being able to help people. Excuse me.
Need some water?
No, I'm good.
Okay.
So I like to work. I like to work with my hands. I like to build things. I like to produce things, and at the same time, get to know the person that I'm working on, because that relationship really is the foundation of the practice, and that basically what makes our practice stand apart is that our full attention really is on the relationships and how we can build a relationships with the patients, so that we can promote a high level of care with a high level of expertise, with a high level of trust that the patients have for us. In that case, in that sense, we're a large practice. We offer all facets of dentistry. We don't really refer a lot of treatment out. We're able to do a lot of it here because there's a considerable amount of time is spent on advanced training, so that we can provide, the patients with the highest level of care, whether it's cosmetic dentistry, Invisalign, simple fillings. We see families. We really don't turn anyone away. Anyone who's seeking dentistry, we can provide the care that they need.
And that's probably a pretty decent advantage for patients. I think that I have seen a trend that slightly more and more patients would like to be doing things under one roof, and yet they still want to make sure that it's not a patch job, it's not a jack of all trade kind of who works on them, but somebody who knows the field. But they don't want to be referred and having to deal with scheduling in another practice and come back and one dentist blaming the other one. He should do that. He should do that. Just kind of like have one, like a good, beautiful philharmonic orchestra, like have one way orchestra through the practice. It looks like patients like that, right?
Yeah, it's a better continuity of care. Patients don't fall through the cracks. They appreciate being able to stay here. In the past, they were referred out for a number of procedures, but we're able to do it here, and they're very happy, and we get great results.
Beautiful. So you see children, you see elder people, and you see people with orthodontic work, doing the Invisalign and all that stuff. And so basically you're up to date. Your practice is, you do implants, I suppose?
Yes, we place implants and we restore them.
Beautiful. Well, all right. Anything you care to say to, let's just say, the average patient seeking dental care, something he should be, looking for or being aware of, or whatever it might be?
I say the most important thing is that they understand the treatment that they're having done, and that they trust whoever's making the recommendations. If there's
Which comes back to what you said before. You've got to have a relationship. You've got to build a relationship. Exactly. Clinically, many doctors, I assume, and tell me if I'm wrong, are relatively good, but then it's kind of a little bit like with getting married. There are lots of pretty girls out, or girls who know how to cook well, or whatever it is you're kind of seeking for, but there gotta be like a certain match, and
yes,
you gotta feel comfortable talking to your spouse about anything and everything more than with anyone else. Otherwise, it's just not a good relationship. And I think something so personal like dentistry, that's what you're alluding to. That's what should happen, right?
Well, absolutely. And, you know, a lot of times when we have someone come in for a second opinion, it's not because the dentist gave them the wrong information. It's just how it was presented to the patient, which made them question whether they should have the work done or not. And it's really a matter of communication. Yeah.
Right. In fact, that is a big thing that quite often, as more technical and highly educated a particular profession gets, and dentists, doctors, fall, right in there, lawyers and, all those people, they sometimes lose the ability to talk to the patient in a layman's term. All they can talk is clinical balderdash, which that's just what it is to us. Do you know what I'm saying?
Right.
It just needs to be, funny. When we talk to a 3-year-old, we change our way of language because we know the 3-year-old doesn't understand the way we normally talk. And doctors sometimes, in relation to that, are supposed to do just that. They got to talk to us kind of like a 3-year-old and really kind of go in and have that last. So, Mr. Schmidt, do you still any questions about it? Because you only should go ahead if you really know that this is kind of what it is, not just because I say so.
That's right. Exactly. And a lot of times, those 3-year-olds are smarter than you think. They may actually be able to understand you.
Well, they surely wave themselves around the computer much better than I, that's for sure.
Yep.
Thank you very much, Dr. Leigh.
Sure.